Okay, so we're going to talk now about professionalism. So, what does professionalism look like? I want you to think for just a minute. What do you think makes someone professional or not in their actions? One professional responsibility is advocacy. An advocate is a protector and defender of rights. So, it is our job, our role as advocates to defend our patients' rights, to support our patients' rights. Part of advocacy is speaking for clients who are unable to self-advocate. Remember that patient autonomy, though, and remember that one of the rights we are supporting is autonomy. So patients have the right to speak for themselves, but we can speak for those who are not able to advocate for themselves. Protect the right to informed decision making. Another aspect of advocacy is knowing when someone's needs are outside your scope of practice and referring to them to the appropriate practitioner. You may advocate for the patient, but we may also advocate for self, colleagues, for the profession, for healthcare systems, for facility. Advocacy is about knowing and understanding boundaries and personal rights to autonomy, and about assertive communication. Another way that we look at professionalism is through accountability and responsibility. We need to be accountable to ourselves. We're accountable to ourselves for our physical health, our mental health, our moral health. We have a responsibility to ourselves to protect our license and to present ourselves when working in professional ways, professional appearance and behavior. That means I should go to work clean, dressed in clothing appropriate to the setting. So it's going to be different here in the office from in a healthcare facility and clinical, right? And I have a responsibility to myself to present myself and to behave in a professional manner. We're accountable to colleagues, and at times peers may either formally or informally hold us accountable. Peer review is a form of colleague accountability. We're accountable to our employer for following policies and procedures, and we're accountable for following and fulfilling our contract with our employer. We're accountable to oversight agencies in healthcare. We have JCO, we have CMS, we have state inspectors. So we're accountable to those oversight agencies, and we're accountable to follow the guidelines and standards that they set. We're accountable to the profession. We have a responsibility to present ourselves to be a good representative of the profession. Another aspect of professionalism is professional growth. We are responsible for maintaining a current knowledge base. Some states require continuing education, but we all have a responsibility to remain current. That includes being technologically current, being able to use nursing informatics at the level required for our position. That also includes evidence-based care, which means we need to be aware of new research or research that has new findings. And we're responsible for responding to changes in society. There have been changes in my career in the demographic of where we live, in the way healthcare systems are, the way healthcare is delivered and paid. There have been changes in the global community, and there have been technological advances. So I want you to think about what nursing looked like when you became a nurse, and how has the world changed since then, and how has that affected healthcare? One major change in the last 28 years, yikes, has been that I started out charting on paper, and now almost no one charts on paper. I actually went to a facility in the 90s that was an early adopter of EHR, and they had a really great system, and I loved it. And most EHR since then I really haven't loved. But we've gone from charting on paper to EHR. We've gone from using a paper MAR to clicking or scanning at the bedside. And that's one change. There have been so many changes in healthcare since I became a nurse. You're responsible as a nurse for keeping up with those changes. We have a responsibility to the profession, and that means maintaining the standards of the profession, but also participating in the discussion of what those standards should be. We can participate in nursing research. We can recruit and mentor new nurses. We can move into nursing leadership. Professional organizations are one way to fulfill some responsibility to the profession, but you have a responsibility as a nurse to further the profession. One last thing I want to talk about with professionalism is professional boundaries. Boundaries can be challenging, especially in a small town, because we may know someone as a person, we may know someone socially, and then they come in as a patient. So how do we maintain professional boundaries with our patients? Does not mean that you cannot have any feelings about what's going on with your patient. First of all, there is a zone of helpfulness. We want to be close enough to that patient to be helpful to them, but we don't want to violate their personal boundaries. Nursing is a power imbalance. We have power over our patients, and so we have to be aware of the risk of abusing that power. The interaction between patient and nurse should be based on the patient's needs, not the nurse's. Boundaries can be really tricky, like I said, when we already know that patient. And so sometimes we have to draw a pretty thick line there. Some examples of potential boundary violations: sexual or romantic relationship with patients. That's very clear. That's a giant neon sign, right? Violation of privacy or confidentiality. That's one that happens a lot in small towns. Financial abuse or financial involvement with a patient. Oversharing personal information. That one's really easy to do too, because there is a level at which sharing some personal things about yourself can help develop rapport with a patient. Working in labor and delivery, there were times that I might talk to patients about my labor experiences. But if I'm unloading my personal things on this patient, then that's become about me, not about the patient. So anything that we share, first of all, be cautious of safety. We don't want to share things with everyone. So be cautious about sharing things that may impact your safety. But also anything that you share should be with the goal of the patient's needs being met, not your own. And attempting to influence patient decisions, that's a boundary violation. If I really think that this patient needs to go to rehab, and I try to push and manipulate and give them only the pieces of information that I think will lead them to go to rehab, that's a boundary violation. I don't get to make that decision for the patient. Sometimes patients have to, well, always patients have to make their own decisions, but sometimes patients make decisions that I don't think are good ones. I don't get to question those decisions. It's not my choice. Okay, so we're going to come back and talk about ethics in, I think, the last video in this lecture.